Great. Well, welcome. So yeah, good afternoon. Welcome to this session. I'm really excited to be here talking to you guys today and to be a part of this amazing symposium. And I'm grateful and happy that you decided to attend this topic. So I just wanted to give you a little bit of background. Like Lisa had mentioned, I got involved in hoarding intervention work in 2015. I was working as a case manager, working with folks with disabilities, and didn't really know that much about hoarding to begin with. There were 3 or 4 folks on my caseload that had hoarding behaviors, and I really didn't know much about the condition or things that I could do to help. And that's what led me to get involved in the Hoarding Task Force in Philadelphia. From there, I realized it was a very important and interesting topic that I wanted to get more involved in. And kind of over the last 8 years, I've made it kind of a more prominent feature of the work that I do. So I'm really happy to be here. I want this to be very interactive and engaging. Please feel free to ask any questions that you would like. And yeah, we'll kind of go from there. So during our time together today, I'll go ahead and provide kind of an overview of what hoarding disorder is, the way that it impacts individuals, family members, the community. We'll kind of talk about how it's diagnosed, different risk factors that lead to hoarding, different health and safety risks that are associated with hoarding, and then we'll kind of end our conversation today going over some resources that are available in our region, in Philadelphia and Bucks County, and some things that we might be able to do as individuals, family members, case managers, professionals, whatever your role might be, that can just help support an effective hoarding approach, intervention approach over time. Okay, so before we dive in, I just wanted to ask a few questions just to kind of get us interacting and thinking a little bit. So I'd love to know how many of you have the following things in your home. I'm going to ask you to type in the chat box um, and share with me if you have any of these things. So how many of you have a junk drawer that's full of just in case items? Let me see, and I'm not sure if I can see the chat, so let me see if I can figure that out. Just one second. Okay, I'm going to stop sharing and I'll look at the chat. Okay, yeah, so I see quite a bit of folks have a junk drawer with just in case items. So full disclosure, I do too. I think many of us do. What are some of the items that you might have in the junk drawer? I'm just curious what some common items might be. I see some folks have more than one drawer. I think I do too. Batteries, keys, rubber bands. Yeah, batteries, flashlights, hair ties. Yeah, yeah. Okay, awesome. All right. I'm going to ask another question now. Here, I'll go ahead and pull my screen back up. Let's see. Hmm. Bear with me. I'm not seeing the share screen button again. Hold on.
You might have to hover at the top, Danny, for it to appear.
Okay. Hmm. Yeah, let's see. I'm doing that. I don't see it.
It looks like a picture. Yeah.
Oh, if I do this, can you see it? Okay, let me try this one more time. Ah, here we go. Okay. All right, so how many of you have a fairly heirloom that's sentimental or meaningful to you? Yeah, I'll go ahead and take a look. So a lot of yeses, a bunch. Yep, I do too. So if anybody would like to share, what are some of the sentimental items that you have in your home? Pictures, ceramics, pictures, furniture, family pictures. Yeah, vases. Gifts, yeah, father's tools, gifts. Yep. Well, great. Okay, and then one more question for you. Um, how many of you have made a purchase of something that you liked, but maybe didn't necessarily need? Has anybody done that before? Okay, I'm glad that I'm not alone. Yeah, I think we can all relate to that just a few times, right? And so, what are some of the items that you might have acquired, that you might have purchased that, you might have not needed it, but yeah, it's just kind of fun to buy. It was kind of fun to have. So yeah, we have candles, tools, clothes, sports equipment, Xbox, clothes, technology, jewelry. Yeah, knickknacks. Awesome. All right. Well, thank you guys for being so interactive with that. It's always fun to see kind of what stuff we have and kind of what our attachment is to our stuff. So I'm going to share my slides again. Okay, so the reason why I like doing this exercise at the beginning and asking these questions is it really highlights the different reasons that we keep our possessions. So we all tend to keep things that have instrumental value, things that are useful, things that we could use in the future. We might not have a really strong attachment to it, things like batteries, scissors, things in our junk drawer, but they're needed, they're useful. They kind of help us live our day-to-day lives. We also keep things that are sentimental to us, right? Things that have meaning, things that bring back fond memories, things that remind us of the people that we love, the experiences that we've had. Um, and then the third is we all keep possessions that just have intrinsic value. There's maybe nothing in particular about it that's meaningful or important, but we just like it. Maybe we like this picture that we have. Maybe we like, these pens that we own. They're just things that we enjoy having. What's important to note is that people that have hoarding behaviors keep their items for the exact same reasons that we keep things. For these three reasons: things are useful, things are sentimental, and we just like things that kind of have intrinsic value to us. What's different though is that people that have hoarding behaviors have a much stronger emotional attachment to these things, and just they have more of each of these things. But the fundamental reasons for keeping them are the same. And I think it's important to kind of point that out. And whenever we're thinking about hoarding or talking about hoarding, is kind of being grounded in that commonality helps us take a more compassionate, understanding, and empathetic approach as we start to work with folks that have hoarding behaviors. So hoarding isn't kind of a new phenomenon that's kind of come out of our modern kind of materialistic, consumeristic culture. It's really been an age-old problem. It's been around for hundreds and hundreds of years. One of the first written documented accounts of hoarding was from Dante's Inferno. And in the Inferno that was written, thinking about 1314, so quite a while ago, Dante was talking about kind of a circle of greed, and he talked about people that had hoarding behaviors who would be paired and coupled with folks that were wasters, and that kind of combination of those two personality types, was kind of meant to torment that individual. So we've seen hoarding kind of come up in popular culture since then. We've seen it across culture, across generations, across time. We've seen these behaviors, it's kind of a common feature of our shared humanity for generations. Um, but our scientific and kind of therapeutic understanding of hoarding hasn't really come about until the past few decades. So we didn't really know what it was or some of the psychological, biological mechanisms underneath it really until the last 10 to 15 years. And in 2009 and 2010, hoarding really kind of made a much broader appearance in our culture. It became much more visible with the TV shows that have been put on air. So there was Hoarders and Hoarding Buried Alive. And both of those shows have kind of been a double-edged sword for ongoing work with hoarding. So on the one hand, they've been really helpful because it's brought more awareness into the condition and the disorder, and that's kind of spurred more interest in creating services and supports and kind of helping folks live a healthier, safer life as a result. But the downside of the TV shows, though, are that they tend to sensationalize the disorder and they tend to paint it in a very extreme, exaggerated effect. And that's kind of led to an ongoing like stigmatization uh, of the condition. So in that sense, it's kind of been both good and bad for the work that's been done in hoarding. Another event that was really helpful in bringing hoarding kind of to the public awareness was this case of the Collier brothers. So it was Homer and Langley Collier, and they lived in a Manhattan brownstone home in the 1940s. Um, they were known from their neighbors as being, just quiet, interesting, but a little bit eccentric. But just they were kind of known to just be friendly, kind of secluded, a family that kind of kept to their own business. In 1933, though, Homer became blind and Langley decided to become his caregiver. And now Langley had kind of some interesting kind of beliefs and opinions about health and how to take care of Homer. And one of his recommendations was to give Homer a diet that consisted mostly of oranges because he believed that that would restore his eyesight. So he cared a lot about his brother and he wanted to help him regain his vision. Um, and he was quoted as saying once that he started to collect newspapers every day. So that way, when Homer would regain his eyesight, he'd be able to catch up on the news. Um, it turns out, though, that Homer was collecting a lot more than just newspapers. So over decades, he acquired more and more stuff and kind of did it in secret. Nobody really knew how much was in his home. But after the brothers had passed away, the city of New York, had to come in and do a clean out for the home. And they found about 140 tons of items that were inside this one brownstone home in, I think it was in Harlem. And what was interesting, both brothers had accumulated about 25,000 books. There were 14 pianos in the home, and there was even a Model T Ford that they had to bring in parts and then assemble inside the home. So after this discovery, this was in the late 1940s, there really wasn't kind of a framework of hoarding as a mental health disorder. Folks kind of saw it as being eccentric behavior, it's kind of being unconventional, but it did bring this issue kind of to public light. And this was kind of one of the groundbreaking stories of hoarding that was documented in kind of popular culture. So you might be wondering now, well, how common is hoarding? And it might actually be more common than you would think or that you would assume. So the latest statistics show that about 2 to 5% of the population have hoarding behaviors. If we had to guess, we would think that the percentage would be closer to 5%. The reason for that is a lot of folks with hoarding behaviors don't seek treatment. And that could be for various reasons. That could be a lack of financial support. Right now, therapy is kind of one of the most effective treatments for hoarding behavior. And we know that having access to behavioral health services can sometimes be challenging. Another reason is that people that have hoarding behaviors might feel a sense of shame or stigma. And that kind of goes back to what we were saying about the TV shows. Culture hasn't necessarily created kind of an understanding, empathetic approach to hoarding. And then another factor might be that folks with hoarding behaviors might not have a high level of insight into the nature of the problem and don't seek treatment. That's why it can range from 2 to 5%, but we do think that it's underreported, and it's probably closer to 5%. So if hoarding is about 5% of the population, that would mean that it's about 2 times the rate of OCD and 4 times the rate of bipolar disorder and schizophrenia. So, much more common than some other mental health conditions that we see in the DSM. Just for fun, I decided to do a quick calculation of how many folks in Bucks County have hoarding behavior if we kind of assume this 2 to 5% a prevalence rate. And so that would be anywhere from 12,500 to 31,000 people in Bucks County. So it's quite a large percentage of the population, and I think that's just another reason why it's really important to be aware of hoarding, what some of the effects of it are, and what resources are available, and how we can kind of expand the services and supports that are available to folks. And the last thing I'll point out about the prevalence of hoarding is that the behaviors usually start in adolescence, but they often become more problematic with age. And part of the reason for that is it can just take time for folks to accumulate enough stuff to where it really begins to hinder their health and safety. Um, Other times it can be because, um, folks can kind of live independently and, not have much communication with other people or other service providers, maybe until they start having other health conditions or chronic conditions that might require folks to come into the home. And that's when it becomes discovered. But, we do find that hoarding disproportionately affects the aging population, but that the behaviors do tend to start a little bit earlier in life. Okay, I'm going to do a quick true or false question, and we'd love for you once again to type your answers into the chat. So people who hoard are usually unclean or unsanitary, collecting perishable items that lead to rotting and infestation. True or false? Seeing a lot of false.
Danny, just so it doesn't get lost, before you ask that question, there was a question from a participant.
Oh, great. Thank you, Lisa. Yeah, I can go ahead and answer that question right now. I will say I will save some time at the end for Q&A, but if you do have questions that you'd like to ask, either clarifying questions or questions that might be relevant to a particular slide, feel free to type it in the chat box.
Do you want me to read it to you so you don't have to go looking for it?
Sure, that would be great.
What are the research studies that demonstrate mental health treatment can help to reduce hoarding behavior?
Yeah, that's a great question. So I can't think of the name of a particular study, but what I will say is I know from the research that I've done, they find that cognitive behavioral therapy is a therapeutic technique that's been helpful for hoarding behaviors. I do have some research studies kind of saved in my drive, so I'd be happy to go back and take a look. I don't have the name of particular studies kind of off the top of my head, but CBT has been one of the most studied treatment modalities for hoarding. I hope that helps. Okay. See, I see something in the chat. Homes that have been in with hoarding, there have usually been unsanitary conditions. However, some hoarders within public are clean and well dressed. Yeah. Okay. So we'll go ahead and debrief this true or false question. So I see most folks say false. I've seen a few trues, and generally the answer is yes, it's false. So for unclean or unsanitary conditions, sometimes we'll refer to that as squalor. And there are certainly cases where hoarding and squalor can co-occur. Sometimes there might be the presence of rotting food, human or animal waste, things that would create a health hazard. But the majority of folks who have hoarding behaviors tend to have dry and clean homes and don't have the presence of any health hazards. In that sense. So, I'll share just a quick example. When I was doing some hoarding intervention work about 4 years ago, I worked with this one individual who had pretty severe hoarding behaviors. He had boxes in his living room that went about 7 feet up, kind of throughout his whole living room. But he did keep one area of his carpet that was, maybe 3 foot by 3 foot square, and he would vacuum that every single day. So it was very clean, very tidy, very orderly, but just had a lot of stuff. And that's kind of what we typically see with hoarding behaviors. Okay, I'll go ahead and pull up my slides again and we'll keep going. Okay, so that was kind of meant to be kind of the introductory part of our presentation. We're going to dive deeper now into understanding hoarding, both from its kind of clinical diagnosis and what some of the contributing factors are to hoarding disorder. So let's start with kind of distinguishing hoarding from maybe some other types of behaviors that we've seen. So once again, I'd love to see in the chat, what do you think is the difference between hoarding and collecting? Anybody have a thought on the difference between hoarding and collecting? None, okay. When it overwhelms your life, organization, emotional attachment, more value with collecting, organization, it impacts functioning, organization and display. Yeah, so you guys are all kind of right in the same, right in line with each other. And yeah, all of that has a big part to do with it. So one of the main differences between hoarding and collecting is that people who have collections tend to, have one particular item that they are passionate about. And so it might be old stamps, it might be coins, foreign currency, it might be action figures, which I think was the example in the picture that was on the slides. And these items tend to be displayed in a very categorized and kind of organized way, usually with the intent to kind of display it or be able to show it to other people. Whereas, right, with folks with hoarding disorder tend to be very unorganized. Things are not really stored or kept in a particular fashion to be displayed, and it tends to be different types of objects. So it might not just be one thing, it might be kind of a wide array of different types of objects or belongings. All right, so let's go on to the next question. What is the difference between hoarding and clutter? I'll give you a second to think about that. This one might be a little bit more difficult to answer. The difference between hoarding and clutter. Okay, so not much, none. Clutter sometimes needs to and is cleaned up. Nothing really. Clutter can easily be cleaned up. Okay. Lack of space. Clutter is more organized. All right. Let's see, one more here. Clutter often shows a need for more storage. Hoarding is more a need to hang on to things. Yeah, so I think you guys are really starting to kind of get to that underlying emotional attachment people with hoarding behaviors have to their things. So the difference, one of the main differences is clutter can be temporary, where hoarding tends to be chronic and persistent. So clutter, your homes might be cluttered due to kind of a change in life circumstances. So if you maybe have a family member that has recently passed away, you might inherit a lot of items, and then they might just kind of clutter part of your home for a while, and it just takes some time to go through them and kind of get things organized again. Or if you think about having a child, chances are you'll have to accumulate a lot more stuff in your home, and as that child kind of grows, you can start getting rid of things again. So that's kind of a main difference. That clutter, can be temporary, and it doesn't really involve that strong emotional attachment and reluctance to let go or to get rid of things. Okay, I'm going to pull my slides back up. Thanks for bearing with me as we kind of go back and forth from the chat to the slides. This is, I think, the most interactive part of our presentation today. Okay. So let's talk a little bit now about how hoarding disorder is diagnosed in the DSM. Kind of what are the features that have to be present for somebody to have hoarding disorder? And there are really 5 different considerations that we need to make. And after we go through these 5, we'll kind of talk a little bit about why it's important when we're working with folks, kind of ask really curious, critical questions to help figure out whether or not the stuff that we're seeing, if it's actually a form of hoarding, or if it's clutter or collecting or something else that we would take a different approach to address it. So the first criteria of hoarding disorder is a difficulty discarding. And so this means that folks have a really strong emotional attachment to the things that they own, and it causes some distress and discomfort and a lot of negative emotions just thinking about getting rid of it. So there's a strong emotional pull to keep and acquire and to not be able to discard it. So common things that are often hoarded might be mail, could be old magazines, books, could be clothing, um, could be kind of arts and crafts. So folks might have a lot of tools, a lot of resources, things that they'd like to make or create, um, lots of gifts. So oftentimes folks will see things that they'd like to give to other people, but the only difference is those items usually never actually get given as gifts. They just keep accumulating. Um, but those are kind of some of the common things that are held onto in hoarding disorder. The second feature is an accumulation of stuff that prevents the normal use of space. And so what this means is that over time, the possessions that somebody has begins to take over a lot of the usable space in the home, whether that's the living room, the kitchen, bedroom. It doesn't necessarily apply to the storage areas, like a basement. But if there are, regular parts of the home that folks kind of use for their daily living tasks, and if the clutter begins to prevent them from being able to use it in its intended way. So for example, if somebody can't sleep in their bed because there are too many things, on top of it, or they're not able to have anybody over for dinner because the dining room table is too full of possessions. If you can't cook in the kitchen because there isn't enough room on the countertops, things of that nature, that's when hoarding would begin to become a problem and could be diagnosable. And then the last criteria that needs to be present is distress or impairment. And distress or impairment is really broad. That can be emotional distress. If the hoarding behaviors kind of create, a sense of shame or guilt, or if it impairs folks from being able to maintain close relationships with their friends or their family, if it gets in the way of steady employment, those would all be instances of distress or impairment. But similarly, it could also be features that might jeopardize the health and safety of an individual. So if the accumulation of stuff might prevent utility workers from coming in the home to do necessary maintenance or repairs, that would also be an instant of distress or impairment. So there are really lots of different things that would fall under that category. So those are the three features that need to be present. So difficulty discarding, the accumulation of stuff that prevents the normal use of space, and distress or impairment. It's important to note that we would not diagnose somebody that had hoarding behaviors if the clutter was due to some other medical condition. So the example I often like to use is if somebody has chronic pain or fibromyalgia and they live on the second floor of an apartment building, and week after week, recycling garbage tends to pile up in their home because it's too physically painful for them to take the trash downstairs. That would not be hoarding. That would be clutter caused from a medical condition. And like I was saying earlier, our intervention or treatment for that, might be different. That person might need personal attendant care services to have them, help with kind of maintaining the home. They wouldn't necessarily need hoarding intervention services. And then the other feature to take note of is that hoarding isn't due to some other mental health condition. So oftentimes hoarding does co-occur with other mental health disorders, such as major depressive disorder, generalized anxiety disorder, OCD. But if the clutter is due to, let's say, a lack of motivation for major depressive disorder, then it wouldn't be hoarding. There really needs to be that strong emotional attachment to the stuff as kind of the primary feature of hoarding disorder. Otherwise, you would attribute it to something else. So I hope that all makes sense. If there are questions, please let me know, but I'll keep moving on, assuming that we're good. Okay, So in addition to those 5 diagnostic criteria, we do find that folks that have hoarding disorder, about 80 to 90% of them also have excessive acquisition. So what that means is that they compulsively acquire new items, whether those items are bought at the store, thrift store, or whether they acquire them for free, whether that's, just giveaways at different stores or promotional things, whether it's items from the street or maybe things that they found in the dumpster or other places. But it's that compulsive acquisition that typically accompanies hoarding disorder. Now, it's important to note that this doesn't have to be part of the diagnosis, but just this behavior, we do see that this is very common for folks that have hoarding disorder. Just a quick story about this. When I did work with an individual once who lived just a block away from a thrift store. So every morning he would leave his apartment, go to the thrift store, and he would buy new VHS tapes for a quarter. He would buy new books. He would buy, diningware sets. He would buy electronics. Just kind of anything new that had come in, and that increased the severity of his hoarding behaviors. Of course, the clutter, the accumulation, was accumulating at a much faster rate. So in that sense, it can make it more complicated for intervention. So usually what we try to do if there's excessive acquisition, that might be the first place to start. Some research suggests that excessive acquisition is easier to treat than difficulty discarding. I won't go into the specific techniques right now. That's really meant more for a hoarding intervention training, but it's you can do things a little bit like exposure therapy, where you might first have somebody walk past the store without going inside and to see how uncomfortable that feels. Then maybe you walk to the front door the next trip. Then maybe you go inside but don't touch anything. So you can slowly start to get people more comfortable experiencing that tension or discomfort of wanting to acquire something and then not acting on those beliefs or those feelings. And that might be one of the best places to start if you come across hoarding or excessive acquisition in your work. Okay. So let's talk a little bit about why it's hard to discard items. So what differentiates hoarding disorder from some other mental health conditions is that there are some really strong positive emotions that accompany hoarding disorder. Whereas generalized anxiety disorder, major depressive disorder, those are characterized, mostly by strong negative emotions. But hoarding disorder also has kind of reinforcing behaviors of positive emotions on the other side. So when looking for or acquiring a new item, there might be feelings of extreme joy or delight or excitement. I can't believe I found this. This is an amazing deal. This will complete my collection. There's a lot of positive emotions there. Similarly, in the home, sometimes with sorting and discarding, somebody might find an item that they've been keeping in their home they haven't seen maybe for the last 5 or 10 years. And just finding that item again might create a lot of positive emotions and excitement that, wow, I remember this item. I remember this memory. This was such a good time of my life. So those positive emotions might make it difficult for folks to choose to get rid of certain things. In addition to that, there are strong negative emotions that accompany hoarding, whether that's guilt, fear, or anger. Sometimes going through their old possessions, folks might, just for one example, find, let's say a really nice dinnerware set that they remember their mother bought when they were a child, and they remember how hard their mother had to work in order to purchase this, and they would just feel so guilty getting rid of this dinnerware set. Just the thought of that would just feel so bad that might be a reason not to declutter or to start discarding. There's also a great deal amount of fear getting rid of things. What if I would need this again? What if I couldn't find it again? What if I ran out of food, whatever it was? So the strong negative emotion of fear is also a motivator to keep holding on to various things. There's also a really strong belief that items are valuable or useful, despite what the actual objective value might be of that object. Um, so I like to say that people with hoarding behaviors are, um, they're very creative, they're very, insightful, and they tend to see features of items that are extraordinary that other folks kind of might miss. So something might be just the perfect shade of blue, or something might be just the right type of fabric to do this project, or might be kind of a limited edition thing that you just can't get anymore. And kind of that added layer of value might take away from their willingness or ability to consider getting rid of it without some coaching or some support. In addition to that, people might have a feeling of being responsible for objects, and sometimes they might think of inanimate objects as having feelings themselves. So sometimes people that have hoarding behaviors might project their own feelings about what it would feel like to be discarded or to be thrown away onto the items or objects. So, someone might have a thought that, well, I can't even imagine what it would feel like to be thrown away, and so I can't throw away this extra, pair of clothes that I have over here. And then lastly, there's oftentimes kind of limited insight into the nature of hoarding disorder, or kind of a limited awareness of how the clutter is actually negatively impacting someone's life. And so just that lack of insight or awareness can, be one reason why it's hard for folks to discard their items. If they're not really clear on why it's a problem, they're not going to be as motivated to start getting rid of things. So this list isn't all inclusive, but hopefully it just starts to paint a picture of why it can be really challenging for somebody that has hoarding behaviors to choose to start discarding their items. They have to kind of overcome a lot of different thoughts, feelings, and kind of ideas they have about their possessions to then start making progress. So now we'll talk a little bit about why people hoard. What are some of the risk factors to hoarding behaviors? And we'll approach that from kind of a traditional biopsychosocial approach. All three variables play a part. And so we'll just kind of unpack those piece by piece and just give you a sense of what some of these features are. So we'll start first with the biological factors that contribute to hoarding. Researchers are finding that genetics do play a part. We don't know exactly how much of a part that is, but we know that there's a much higher risk of an individual having hoarding behaviors if either their parents, a sibling, or somebody else in their close family has hoarding behaviors. So we do know that there is a genetic link there. I'm not a geneticist by any means. One of the studies was saying that it might have to do with chromosome 14, so I think they're studying this in more depth. Maybe somebody else on the call might know more about that than I do, but just know that that is an area of research, and it does seem to be that there is a pretty strong genetic predisposition to hoarding. Another biological factor is just differences in brain activity and brain functioning. So specifically, we see that the frontal lobe, which is responsible for decision making, attention, impulse control, categorization, kind of spatial mapping, all of those areas of the brain tend to be kind of less active or have less blood flow, or just differences in activity than people that don't have hoarding behaviors. So there is that biological component there as well, with kind of how our brains might perceive, pick up on, and process information. So related to that, we do see these various information processing deficits. So it tends to be difficult for folks with hoarding behaviors to be able to focus on one thing or to have sustained attention over time. It's not uncommon to actually have a dual diagnosis of hoarding disorder and ADHD. So we do know that our ability to pay attention and fixate or focus our attention on one task for a sustained period of time is kind of another correlate to hoarding disorder. Another is categorization. Whereas most folks kind of are able to categorize items in like form and like sort and kind of keep them clustered together. It's a lot more difficult for people that have hoarding behaviors to do that because they're able to see kind of more layers to the items that they have. So they could be categorized in a much broader range than other folks might come up with. So just as a quick example, in terms of categorizing our belongings, um, so most folks might categorize all of their kitchen utensils, in one drawer in the kitchen. So all of the knives, spoons, and forks might go in this drawer, and that's where they're all kept because they're of a like item. People with hoarding disorder tend to kind of categorize more by use and by space. So they might have a spoon in every room of the house because they might be eating soup in the living room, in the kitchen, in other places. So it's more important to categorize by location than by type. Um, Not everybody necessarily uses that categorization, but we do see that that's more common in people that have hoarding behaviors. Um, Complex thinking. So, like I was saying before, people that have hoarding behaviors are very creative and can engage in some pretty detailed, complex thought patterns. And they might be able to think of a lot of kind of really interesting, creative reasons for keeping things that most other folks wouldn't have thought of. Decision making can also be a little bit of a challenge. Um, so oftentimes there's kind of this heightened ambivalence towards um, the possessions that they have. So even if they might want to discard something, being able to make that choice and know which thing to get rid of, which thing to hold on to, tends to be a much more difficult decision than other folks. And the last is memory. So we see that people that have hoarding behaviors tend to kind of be afraid of losing their thoughts or losing access to different memories that they've had, and everything should be in view. Whereas, most other folks might keep, um, things kind of stored away in drawers and, um, cabinets. People that have hoarding behaviors like to have everything out in the open, so that way it's kind of a visual cue, and things in their possession might trigger different memories that they've had. So now let's talk a little bit about the psychological factors that contribute to hoarding. So there are mental health and emotional stress. Oftentimes, hoarding disorder can kind of come as a result or be exacerbated from kind of unresolved trauma or stress. So it's not uncommon for folks to have higher severity of hoarding disorder after a traumatic event, such as a loss of a family member, a car accident. So we often see kind of these underlying traumatic experiences kind of being a catalyst to hoarding behaviors. We also see a strong emotional attachment and kind of unproductive or unhelpful beliefs about belongings being a psychological factor to hoarding. So folks might have beliefs about the usefulness of a particular item and maybe feeling a sense of responsibility not to waste it or not to throw it away or do harm to the environment. There are kind of these beliefs about, well, I own these things, I need to take care of it, I need to protect it, and I need to use it. That can kind of lead into tendencies of perfectionism and fear of missed opportunity. I think this one's really important to be mindful of. It's not uncommon for folks that have hoarding behaviors to have a lot of fear about letting go of things in case that thing might be useful in the future. So we see this a lot with books or magazines or different articles and newspapers. People might have a plan to sit down and read it one day, and there might be a thought in the back of their head that, well, what if this newspaper, what if this magazine contains some information that could dramatically change my life? If I get rid of it, I might miss that opportunity. I might miss learning something that could have a huge improvement on my well-being or my life. So just that fear of a missed opportunity can be a big driver of hoarding behaviors. We've already talked about kind of the sentimental attachment we have to things. So I will say with hoarding behaviors, kind of that sentimental attachment is really heightened. So it's not just possessions that are directly connected to what's meaningful, such as maybe jewelry from from a mother or grandmother, but it might be, a receipt from the grocery store where they saw a friend from high school. And so it's that receipt that reminds them of that very meaningful experience. And so they hold on to the receipt as a memory of the time in the grocery store. Identity beliefs. So people that have hoarding behaviors tend to see their hoarding behaviors as, being kind of protectors of things, or maybe saviors of these items, or especially with animal hoarding, there can be this identity belief that I'm saving these animals. And so sometimes these behaviors become very integrated with how somebody views themselves and kind of their identity, that it just reinforces hoarding over time. And lastly, just feelings of safety, security, and control. Because people that have hoarding behaviors might not have the strongest relationships interpersonally, they can form really safe and secure attachments to their belongings. And that can sometimes fill the void or the gap with kind of the interpersonal relationships that might be fractured or not very supportive or fulfilling in their lives. All right, and then the social factors that contribute to hoarding. So like I was just mentioning, challenging interpersonal relationships. Many people with hoarding behaviors have a difficult time forming and sustaining strong, secure attachments with other people in their lives. It's unlikely for people that have hoarding behaviors to have a partner. Oftentimes family relationships can become strained. And so oftentimes that can just exacerbate hoarding behaviors. Lack of financial support. So we do see that hoarding tends to exist more in folks that are have lower socioeconomic status. And part of the reason for that is there just might be less resources available to seek out counseling, be able to buy more storage space, to have a bigger apartment. So it is more common to see hoarding kind of in a lower income population. Major life events, transitions, and trauma. So we had mentioned that it's common for hoarding to become more severe after a loss, a trauma, some type of major life transition. And then social stigma around hoarding, and maybe beliefs about seeking help or seeking therapy, maybe beliefs about objects or possessions as status symbols. Cultural beliefs about possessions might also be a factor into hoarding behaviors. Okay, so I know we covered just a lot of information there. That's kind of meant to just, no pun intended, but be the tip of the iceberg. But I hope that what you take away from this conversation so far is that hoarding behaviors are very complicated. There's no one size fits all to kind of the reasons that somebody hoards or collects their belongings, and that there's really a lot beneath the surface that needs to be understood, that needs to be helped, and needs to be supported in order for hoarding intervention to be successful in the long run. So what we often do is when we think about hoarding, is we just kind of think about the visible parts of hoarding. We think about, the clutter, how much stuff is in the home. We might be able to observe the saving behaviors. We might be able to observe those acquiring behaviors of going out shopping, bringing new things into the home. But if all we're doing is focusing on the stuff, on the things that we can see about hoarding, we're not going to successfully manage the condition in the long run. And in fact, we might actually and accidentally kind of reinforce some of the unresolved trauma that folks have experienced. And that can ultimately make hoarding behaviors worse over time. So, just like an iceberg, if you would cut off that top layer, what would happen to the bottom? It would just float and we'd have more stuff pop up to the surface again. And so that's what we see if we don't really look at hoarding from a very holistic, very supportive type of context. All right, I'm going to do one more true or false question. People who hoard are usually socially isolated or withdrawn. Think that is true or false? Okay, I've seen a few trues, a few false. Okay, good. We're getting some mixed responses here. Okay. Yep. You still see some truths and falses. I will say that people that have hoarding behaviors do tend to be more socially isolated and withdrawn. Part of the reason for that is just conflict within family members. And unfortunately, a lot of times family members don't really understand much about hoarding behaviors. So, you know, while they might have good intentions, they might, um, try to move or throw away their partner's things without them knowing. They might not understand that it's a mental health condition, and that can just lead to more anger and frustration. But also because of the shame and stigma around hoarding, um, I will say oftentimes people with hoarding behaviors kind of have a desire to organize and to downsize. They might be embarrassed about the condition of their home, but they don't have the tools or services in place to really help them accomplish that need. So sometimes you might see that for hoarded homes, the shades are always drawn. They don't want people to see inside of their home. They might be embarrassed inviting their friends and family over. So it is true that people that have hoarding behaviors, on average, tend to be more socially isolated and withdrawn. Okay. All right. So now we'll talk a little bit about the health and safety risks of hoarding. So there's a risk of personal injury, and this can come about in two different ways. So in the examples of squalor, like we talked about before, if there is rotting food, if there, are animal or human waste, if things are decaying, if anything like that is present in the home, that's of course going to lead to health conditions, respiratory conditions, things that are not helpful from a physical health perspective. But just having so many objects in a home also poses health and safety risks. So what we find is when walkways become very cluttered and very narrow, that it causes tripping hazards or fall risks, and especially with the aging population, um, that can become a big hazard for folks. And then if the egress path isn't wide enough, it can be really difficult for emergency personnel to be able to access the home or to get a stretcher inside or to be able to provide emergency services if that's needed. So we'll cover some of these guidelines in a few slides, but if you encounter hoarding in any of your relationships or your work, it's important to work towards a 36-inch egress path through the home. That's kind of the magic number that meets the minimum safety requirement for a home. That's wide enough to prevent some severe fall or tripping hazards, and is also wide enough for emergency responders to be able to access the home. There's also a risk of fire with hoarding disorder. Um, so what clutter tends to do is it increases what's called the fire load in a home, and that's the combustible material that's present in a specific square footage. So as you can imagine, higher the fire load, the more quickly fire is going to spread, and that can make it really dangerous for folks living in the apartment, in the building, for neighbors, and also for emergency personnel trying to assist. Um, it's estimated that about 25% of fire-related deaths are due to excessive clutter. So it is a really big safety concern for all parties that are involved. So I want to show just this a part of this quick video that shows you a comparison of how fire spreads through a cluttered living room versus a non-cluttered living room. And I think just watching a visual can really help drive home the point that that how big of a difference clutter makes in fire safety. I'll just point out we're about a minute in, and as you can see, the fire is kind of in full force here on the left in the cluttered living room. And if you can kind of see that there are some embers on the right, underneath that chair and kind of up along the side. So you can see the fire starting to spread in the right, but it has not really caught a blaze like the living room on the left. So we can go ahead and stop it there. Yeah, I just think that is such a helpful visual of how dramatically different uh, a cluttered living room versus an uncluttered living room is for a risk of fire. And then the last risk is the risk of eviction. So hoarding behaviors and excessive clutter can cause lease violations, can cause code violations, and can create unsafe structures within the home, and can lead it to be condemned by the public health department or licenses and inspections. And so that's why it's also really important to work with folks on their level of clutter. We know that affordable, accessible housing can be very difficult to find, so we want to do everything we can to prevent an eviction. So I will say one thing to consider if you've ever experienced that or do in the future with any of your work. You can request reasonable accommodation, and that might be one way to just have more time to put some structures and supports in place to hopefully be able to help folks keep their home. Okay, so I want to show you just a few assessment tools that you can use. And what these are good for is it really helps you kind of take stock of the severity of hoarding behaviors and also what some of the underlying health and safety risks are. And so this allows you to communicate with family members, with individuals, landlords, with other social service providers, or with medical professionals, and to be able to talk about hoarding in a very objective way. So that's why these assessment tools can be helpful. You can find them for free online. If you just Google the names of them, they're easy to download. This one is called the Clutter Image Rating Scale. You can just pull this directly offline. But what it does is it shows you 9 different pictures, as you see, of a room that has an increasing level of severity of clutter. You can see the picture on the top left is the first picture that essentially doesn't have any clutter. And then 9 is kind of the most extreme, where most of the living room is filled up. And so this way you can use a numerical assessment of how much clutter is in a room. In terms of hoarding intervention, you usually start to see trouble around the level of 4. So if you see clutter at a 4, 5, 6, or higher, that's when you might want to start thinking about how to have that conversation with folks and how to put some services or supports in place to help them maintain the health and safety of their home. The second assessment tool is called the HOMES tool. HOMES stands for Health, Obstacles, Mental Health, Endangerment, and Structure and Safety. And so this is just kind of a brief checklist that helps you kind of categorize what some of the risks are in each of those categories. So like I said, this is meant to be just kind of a holistic assessment that gives you a baseline understanding of what some of the risks are associated with hoarding for this particular individual. So this can be helpful to do as an initial assessment, or if you do home visits maybe once a quarter, a few times a year, this can just be a good way to track progress over time and to also identify very specific measurable goals for folks to work towards. Okay, so we'll spend the last amount of our time talking about what we can do to help. So I'll try to cover this in maybe about 10 minutes, and then I'll leave about 10 minutes at the end for Q&A. So the first thing we want to do is be really mindful about how we talk about hoarding. The way that we talk about hoarding can either help support individuals in seeking treatment or participating in their own sorting and discarding, or it can become a barrier to individuals wanting to collaborate or to work with us or to make their homes safer So you want to think about what language you're using and try to use non-judgmental supportive language as much as possible. Um, so one of the things that you want to stay away from are using statements of opinion, especially statements of kind of a judgment or an opinion, saying things like, this place is a mess, you have to throw this junk away, how can you live like this, you can't cook in this kitchen. Those types of away and kind of reinforce the negative emotions associated with hoarding and can be a big barrier for them to actually seek the type of services or supports that would help them in the long run. So as an alternative, you want to always ground your statements in facts. So like I said before, you really want to say things like, you need an egress path of 36 inches throughout your home, and you can even explain why. You can say things like, I care that you're able to receive medical help if you would fall or if there would be something would happen to you, and we need to have 36 inches, in your home in order for first responders to be able to get to you if there was an emergency. Um, you know, you can say things like, you are not allowed to have papers on the stove because of the potential for fire, and your piles must be reduced to no more than 4 feet in order to prevent any avalanches in your home. So you want to be very descriptive. You want to be very, fact-based. You don't want to talk about hoarding with judgment or opinions. And also just be mindful of your nonverbal communication too. Even if you might not be comfortable in a home, don't show that with your body language, because that is also going to be a barrier to long-term success. So as you start working with individuals, it's important to set really clear objective goals for what needs to change. So you want to stay away from vague statements and vague goals. You shouldn't just say, we need to make sure that, your living room is safe by the end of the quarter. Well, what does that mean? What does a safe living room look like? This list will help you identify what those safety requirements are. And then we'll give both you and the clients and consumers you work with some actual benchmarks that can help them get there. So this is called the Initial Benchmarks for a Healthy and Safe Home. It's available for free on the Philadelphia Hoarding Task Force website. You can just go to the task force website, and it's a link. You can just click it and download it. You can print it. There's a nice visual that comes with the checklist. So if you give this over to somebody, they can actually check things off once they've accomplished that goal. So it's a really helpful resource that I would encourage all of you to download and to save to your computers. When you're working with folks that have hoarding behaviors, you want to focus on the sorting process rather than a quick reduction in clutter, because the goal is to really help people build the skills necessary to manage the hoarding issue in the long term. As tempting as it might be, I know we would all like kind of a quick fix, but those tend to not be successful in the long run. And even if we might find a clean out company be able to assist to come in and actually kind of clean out part of somebody's home, that is not successful in the long run, and it actually is traumatic, for individuals that have hoarding behaviors. What we find is after cleanouts, folks tend to reclutter their home, and it tends to be more severe in as little as 6 months. So cleanouts are really costly, and they're not effective, and they're not good for mental health reasons. So we try to really encourage folks to stay away from using a cleanout, and instead take more of a long-term case management approach. Like I was saying at the beginning, therapy does seem to be one of the most successful treatments for hoarding disorder, but peer support groups are also very effective. There's sometimes programs run a series called Buried in Treasures. That's kind of built on a peer support model. That's really helpful. Case management is really helpful. Educating family members and friends on hoarding and sorting and discarding strategies is successful. So the more you can kind of take a long-term skill building approach, the more successful this process is going to be in the long run. These are just a few tips to get started. Like I said, this comes from a hoarding intervention training. So this is just to kind of like whet your appetite, just to get you thinking about um, what some of those strategies are. But this would be covered in much more depth if you were actually doing a training on how to do hoarding intervention. But the high level is to kind of use a three-pile system. That way, every item that's touched in the home goes in one of three boxes: things that you're going to keep, things you're going to donate or discard, and things that um, are either going to be trashed or recycled. Um, and so, what you can do is use that three-pile system to then kind of systematically work your way through a home. And what's good about it is it also kind of shows you what percentage of things are being kept versus which things are being discarded. So if you're noticing that, 5 items go into the keep box and one goes into the donate or the discard box, that just kind of gives you a pulse that, okay, we're maybe getting rid of about 20% of the things in this home. So it can just kind of help you set more objective benchmarks as well. Really important to stay grounded in intrinsic motivation for change. So just really pay attention to what matters to the clients that you're working with, what motivates them, what are their long-term goals, what's the best vision of their future self. I worked with one individual who, loved her kids tremendously, and her motivation was she didn't want to leave her home in this condition for her kids to have to go through all of her stuff when she passed. And that love for her kids was enough to motivate her to do a little bit of sorting and discarding every day in order to kind of make her home a lot safer in 6 months to a year. Sorting and discarding can be very emotionally and physically taxing, so it's not recommended to do it more than 15 minutes at a time. Really be patient with people, understand, that hoarding is a mental health condition, that there are strong emotional connections to their items, and that it might be really difficult and emotionally draining to sort for anything more than 15 minutes. And to the best of your ability, try to maintain a calm and relaxed environment because it is so stressful, because it can be so traumatic. Creating an environment that's calm and relaxed can be really helpful and therapeutic through this whole process. Okay, so these are just a few strategies that you can use. Once again, I won't go into depth because these are more for kind of a detailed hoarding intervention strategy, but distinguishing between wants and needs, asking critical questions about possessions, as you're sorting and discarding, asking things like, if you didn't have this item, is there anything else you could use? And then creating rules for sorting and discarding. If you're finding mail that's more than 2 years old, I can get rid of it. So sometimes those rules make it easier to just kind of bypass the decision-making process and can make it go a little bit faster and easier to get rid of things. So these are some best practices. You just really want to encourage flexible and open thinking patterns about belongings and to set concrete goals and plans as you're donating and discarding. So these are the resources that you can use after this training today that hopefully provide a little bit more information for you and can help you learn more about hoarding and also learn more about services that are available. I would absolutely start with the Philadelphia Hoarding Task Force. There's a wealth of information and links on this website, and you can find anything from case management services to books that you can read to trainings that are coming up. There's a whole host of resources available on the Philadelphia Hoarding Task Force website. You can also look to the Institute for Challenging Disorganization, and Jewish and Family Children's Services has a hoarding support program in Philadelphia that has good resources. These are books that you can read. They're categorized in various different segments of the population. So books for anybody, people that have hoarding behaviors, family members, children who grew up in a hoarded home, and for service providers and clinicians. So with that, I will go ahead and open it up for questions. You can feel free to email me at any time. My email is down here below. It's dltdecluttering@gmail.com. But I want to thank you all so much for attending this session. I hope that there were a few bits of information that you found interesting and helpful in the work that you do. And I'm happy to stay on for about 10 minutes and answer questions.
Um, uh, Hi, Danny, this is Holly, can I mention something? Um, yeah, somebody is not muted, that is, we're hearing sirens and talking. So I'm not sure who that person is, but if they could please, mute themselves, it would be appreciated. Thank you.
Thank you, Holly.
Danny,
Okay,
there
so
are a few questions in the chat.
great. Yeah, I'm scrolling through now. I can go ahead and read some of those. If I miss any, Lisa, please feel free to let me know. I'll kind of start here at the top and work my way backwards. So there are not many hoarding resources in Bucks and Montgomery counties. Yeah, that's more of a comment. So I agree with you, Rune. I'm most familiar with Philadelphia, and that's where I'm located. And I know Philadelphia does have um, more resources than the surrounding counties, but I'm hoping that over time, more resources do become available up in Bucks and Montgomery. Okay, let's see. Do you have any resources for Chester County? Therapists, support groups, any agencies that work with Chester County people? I do not, unfortunately, at the top off the top of my head. There might be some therapists that we've interacted with at the Philadelphia Hoarding Task Force with Chester County. I don't know of any off the top of my head, but what I would recommend is either checking in with if there's a local hoarding task force in Chester County, or just reaching out to the Philadelphia Hoarding Task Force. We might be able to connect you to some other people as kind of a next step. How do you handle it if everything is designated to be kept? It's a great question. That does happen more often than I think we would like. There are different ways that you can approach that. I think one is to point out gently and supportively what some of the risks are of keeping everything. So, I would say it's context specific, but let's say if somebody is getting external pressure, maybe they might be facing eviction at some point. Maybe there are certain health or safety risks of the home. Maybe they might be at a greater risk for a trip or a fall. We might be able to say something like, I'm noticing that every item that we're sorting through is going in the keep box. Do you think that's helping us either get closer to or further away from our goal of making your home a little bit safer? And then that might be able to gently open up that conversation. And then you can maybe ask, well, how many things do you think we need to put in the discard box? Like, what percentage of things need to go in there to help make your home a little bit safer? And hopefully that would open up the conversation a little bit more. I will say, kind of navigating those conversations are kind of more of an in-depth hoarding intervention training, but I think just quite generally using supportive language and curious questioning, or like, help me understand why it's difficult to let go of this item. I think just those conversations can also be enlightening and kind of therapeutic. How would a hoarder assess themselves? Which picture would they choose? Would they rationalize? That's another very interesting question. Some people that have hoarding behaviors have very acute awareness of their clutter and their hoarding, and some might have very limited or very kind of a lack of insight into the nature of their clutter. So sometimes people are able to kind of accurately, so to speak, use the clutter image rating scale to assess their home. Some people kind of minimize the risk and choose a number that might be a little bit less than what I might designate for them. So it's nuanced. I wouldn't say there's like a typical response, but I will say about 50% of people with hoarding behaviors do have some lack of insight into the full nature of how the condition might be affecting their health and safety. Okay, I'm going to keep scrolling. Decluttering services are costly, which negatively impact low-income individuals. Yeah, that absolutely. I don't know if I'm seeing any other questions in the chat. If I've missed any, please let me know, or feel free to copy and paste and retype it in the chat. I'll hang out for a few more minutes in case you think of any others. Oh, great. Lisa shared a resource for Chester County in the chat. So thank you for doing that. So anybody who might be looking for resources in Chester County can look at Lisa's recommendation. There's an individual there that has experience with hoarding situations. Okay, tips for a spouse or family member living with a hoarder. I'll share a few. I mean, I think the first tip that I would have would be to seek more education. I mean, I'm not sure how familiar like this family member might be, but I think it's really helpful to have an understanding of kind of the complexities and the nuance of hoarding. I mean, one recommendation is to not throw away your family members' stuff without them knowing. Like, don't try to sneak things out of the home. I know that's tempting, but that degrades trust over time and makes it more difficult to have those conversations. So I would say reading books, education is really helpful. Just encouraging that person to seek other types of supports, and maybe encouraging them to look for some peer support groups as well. But I would really start with education. How long does it usually take to work with somebody before they start to make changes? I mean, I'll say it does depend on the individual. So it depends on how intrinsically motivated they are. So if there's some intrinsic motivation at the very beginning, you can start to see changes almost immediately. If there's more extrinsic, variables that might be forcing them to change, that's when it might take a little bit longer. I'll say, I mean, it might take about well, take this with a grain of salt because, of course, it's very nuanced, but it might take about a month or so to get people accustomed to the sorting and discarding process. And then you might, see a little bit of change over time. But what I would say is it's this process does take a lot of time, so you don't really visually see a lot of progress within the first couple of months. Like, it will take 6 months plus to really start making, I would say, significant changes to the health and safety of the home. It is really the long-term perspective that we're working with here. That's what's most successful. So patience is really important. Kind of giving that time and space to gradually chip away with this. As you're working with folks, you can also recommend, doing, a few 15-minute sorting sessions like every day. So even if it's just a small amount, that starts to add up, and then you might start to see changes, within a few months. But it really does depend on how much time and energy folks are able to put into it. Okay. Any other questions? I want to be mindful of everybody's time because I know you have lots of other informative and insightful presentations to go to, so I don't want to hold anybody up. I think I have until about 2:25, so if anybody has one last burning question, feel free to ask it.
Danny, it's Lisa here. I just want to echo what I'm reading in the chat with how great this presentation has been. Just fantastic information. I appreciate you sharing your insights, and the way that you've presented it has just really, truly been helpful. And I'm glad that so many people are going to get some use out of this and be able to help the clients that they're working with because of what you shared today.
Thank you so much. It was my honor and privilege to be here. I hope that a little bit of my, passion for this topic came through. I mean, it does feel like a very important topic. So I appreciate all of you choosing to spend your time with me today, and I do hope it was useful. And like I said, feel free to reach out. My email is dltdecluttering@gmail.com. I'm always happy to be a resource sounding board if you need anything. So thank you all so much. All right, I will
Thank
sign
you.
off. Take care.